Hi, Petra. Do you want to start by introducing yourself for everyone?
Hi, Kiva. I'm Petra McLoughlin. I'm a higher specialist trainee in my second year of training in child and adolescent psychiatry.
Perfect. And I suppose, do you want to start by telling us what kind of problems you're solving within psychiatry and healthcare?
I'm very passionate about integrated healthcare, and I think very well-meaning services in this country often work in silos. And one of the areas I see very overwhelmed at the moment is GPs. And in psychiatry, when a person experiences first episode psychosis, they may need physical healthcare monitoring, and it can be difficult to access this from overwhelmed GPs. Therefore, I wanted to create a one-stop shop for our patients where they could have their mental health care and physical health care looked at.
Yeah, it makes sense. It's typical you think about people falling through the cracks with things like that as well. And I suppose then what would be your biggest challenge when you're kind of looking into this innovative space?
So the biggest challenge is when you have an idea like this, as doctors, we're often moved around every 6 months, which can make it difficult to follow through with an idea. And with this special clinic I set up, it was difficult to maintain the continuity of it and the quality of the clinic. So I've kept an eye on it from afar and made sure to create templates and a tight policy so that it could be handed over to the next doctor. And we have a wonderful administrator on the early intervention and psychosis team in Sligo who supports the next doctor to keep the clinic running.
Okay, yeah. And I think we talk about that sometimes within the innovative space about those kind of cheerleaders. And like, it sounds like that person in admin is really a cheerleader for your project. What has been your proudest moment so far with regards to your projects?
We looked at data before we set up the monthly clinic and data for 3 years after the clinic. And that looks at whether we're keeping an eye on people's weight, blood pressure, blood sugars, their cholesterol. And I'm really pleased to see that the clinic is now nearly up at 100% with that. So we presented our data there in September in Berlin at the International Conference on Early Intervention and Prevention in Mental Health. So that was a real highlight for the team.
That's amazing. Yeah, to get that kind of international recognition as well. That's fantastic. I suppose maybe a more difficult question, if you had unlimited resources, what would you like to do?
Next. Yeah. So I think the next step would have to be employing a research assistant to investigate if by monitoring the blood sugars and the weight, etc., we've actually improved the health outcomes of service users attending the clinic. And I'd really love to expand what the team could offer in terms of intervention. So if results are abnormal, what can we offer? You know, things like exercise programs, walking groups, healthy cooking classes. And it would be wonderful as well to integrate with tertiary health services such as cardiology, because a lot of our patients are on medications with cardiac side effects. That's the dream.
Yeah, that really like joining up all the dots.
Absolutely.
And I suppose for our last question, if you'd any advice to give to innovators, what would you advise them?
I would say don't be put off. Even if you're moving every 6 months as an NCHD, you can do really good work and set up something that is worthwhile and can continue. So I would say follow those ideas.
Oh, I think that's fantastic advice. Brilliant. Thank you so much, Petra, for your time, and best luck with your project.
Thanks so much, Kiva.
Thank you. Bye.